Today, we're diving into the causes of bladder cancer. Understanding what increases the risk of this serious condition is crucial for prevention and early detection. Stick around to learn how you can reduce your risk and stay informed about your health. Let's get started. 1. Tobacco smoking. One of the most significant risk factors for bladder cancer is tobacco smoking. Research indicates that smokers are at least 3 times more likely to develop bladder cancer compared to non-smokers. The chemicals in tobacco smoke enter the bloodstream and are filtered by the kidneys into the urine. These carcinogenic substances then come into prolonged contact with the bladder lining, increasing the risk of cancerous cell mutations. 2. Chemical exposure. Individuals who work in industries involving chemicals, such as aromatic amines, rubber, leather, textiles, and paint production, are at higher risk. Chronic exposure to these chemicals can lead to their accumulation in the bladder, where they may cause cellular damage and increase cancer risk. 3. Chronic bladder inflammation. Chronic irritation and inflammation of the bladder, such as from urinary tract infections, bladder stones, or long-term use of urinary catheters, can increase the risk of developing bladder cancer. Persistent inflammation can lead to changes in bladder cells, making them more susceptible to becoming cancerous. 4. Previous cancer treatments. Previous cancer treatments, especially those involving radiation therapy directed at the pelvis or chemotherapy with cyclophosphamide, can increase the risk of bladder cancer. These treatments can damage the DNA of cells in the bladder, potentially leading to cancer. 5. Parasitic infections. In regions where parasitic infections are common, there is a higher incidence of bladder cancer. The chronic infection caused by the parasite leads to long-term inflammation and changes in the bladder wall, increasing cancer risk. 6. Genetic predisposition. While lifestyle and environmental factors play significant roles, genetics can also contribute to bladder cancer risk. Individuals with a family history of bladder cancer may have inherited genetic mutations that predispose them to the disease. 7. Age and gender. Bladder cancer predominantly affects older adults, with the majority of cases occurring in individuals over the age of 55. Additionally, men are more likely to develop bladder cancer than women, although the reasons for this disparity are not entirely clear. Possible factors include differences in occupational exposures and smoking rates historically being higher in men. 8. Arsenic in drinking water. Exposure to arsenic in drinking water is a known risk factor for bladder cancer. This is more prevalent in certain parts of the world where natural arsenic contamination occurs in groundwater. Long-term consumption of contaminated water can increase the risk. Understanding the causes and risk factors of bladder cancer is crucial for prevention and early detection. Regular checkups and awareness of symptoms, such as blood in the urine, frequent urination, and pelvic pain, are essential for early diagnosis and better treatment outcomes. If you found this video helpful, please give it a thumbs up and share it with others who might benefit from this information. Don't forget to subscribe to Pete's Health and Fitness for more health tips and updates. We'll see you in the next video.